Hello everyone. Today we'll discuss about probiotics in neonatology. So starting off with its definition, it is a live microorganism. So it is a live microorganism which when administered in a correct dosage, that is in the correct amount, they confer a health benefit to the host. So these are live microorganisms. Okay. First, next is they are resistant to the gastric pH or the gastric acid. So they are resistant to the gastric acid. So they can enter the small intestine and even the large intestine, and they can confer health benefit to the children or to the neonate. Okay. Next, going on with its action, mechanism of action. They have a prevention of GI tract colonization. They can have prevention. They prevent the colonization of GI tract. So prevention of GI tract colonization by variety of pathogens. That is the primary mechanism. By variety of pathogenic microorganism. Okay. So they prevent the GI tract colonization by variety of pathogens. This is their primary mechanism. Next, second. So the metabolites that is produced by this probiotic bacteria, they have a antimicrobial activity also. So metabolites produced by probiotic bacteria, they have a broad antimicrobial activity, that too mainly against the gram-negative organism. So mainly against gram-negative organisms. Okay. Third, this probiotic bacteria will interact with the prebiotic material in the diet and produce an environment that will suppress the growth of the pathogens, and it will minimize the inflammation. Okay, this is the third one. So the this probiotic bacteria will interact with prebiotic material. So in neonatology, the main prebiotic material in neonates will be from the mother's own milk. So the prebiotic material that is present in the diet, that is from the milk, and that will cause. So this both will together will produce an environment that will suppress the pathogen. So that will suppress the proliferation of pathogens and reduce the inflammation. Okay. So the main primary mechanism, as told earlier, it is the suppression of the proliferation of the pathogens and their inflammation. It is the main mechanism of this probiotic bacteria. And how that happens? That happens in 3 levels. So the mechanism of this probiotic happens in 3 levels. That is in the luminal effect. They have a luminal effect. Second, they have epithelial effect. And third, they will have effect in the immunity. The immunity effect is they indirectly cause reduction in the lymphocyte coming to the particular place where whenever the pathogen is there, you know the pathogenesis. No, whenever a pathogen or bacteria is there in a place, all the lymphocytes will be directed towards the pathogen, that bacteria where it is being present. So this will indirectly reduce the lymphocyte coming to that place, and it will reduce the inflammation also. So here we'll have it in the picture. I have this in the picture. First, antimicrobial effects of probiotics. So these include, first one is production of bacteriocins and deficits. So I'll write it here if it is not clear. One first is production of bacteriocins. Second, is this competitive inhibition. Second is competitive inhibition with pathogenic bacteria. Okay. Third, it also inhibits the bacterial adhesion and translocation. Okay. So this will inhibit bacterial adhesion and translocation. Fourth, this will reduce the luminal pH. So once the luminal pH is being reduced, that will create an environment for the bacteria not to survive. So this will reduce the luminal pH. These are its luminal effects. And another last effect, that is in the mucosa. So the effect in the mucosa is this one. They'll enhance the barrier function by increasing the mucus layer. So they'll enhance the intestinal barrier function by increasing the mucus layer. That will cause protection for the gut, like by not allowing the bacteria to enter inside this mucosal layer, that is in the and in the submucosa, mucosa, and in the muscular layer. Okay, so these are the primary and main mechanism of probiotics. How will they protect the gut of the child? Okay, it is a product. First is production of bacteriocins. I'll repeat. Next is competitive inhibition with the pathogenic bacteria. Next, they'll inhibit the bacterial adhesion and translocation. Fourth is they'll reduce the luminal pH, and in the mucosal layer they'll increase the mucosal thickness, and they'll enhance the barrier function. Okay, these are the main mechanism of action of our probiotic. So what are its role in neonatology? So what are its role in neonatology? First, they are mainly used for prevention of necrotizing enterocolitis (NEC) in preterm babies. Second, they have role in reducing the infantile colic. So they have a role in reducing infantile colic. What is the child will have colicky pain? Na? So this colicky pain occurs mainly due to some changes in the diet of the mother. Also it can occur. Okay, so it is mainly the incessant crying of a child for more than 3 hours per day for more than 3 days per week. Okay, I'll tell you about the colicky, infantile colic in a separate topic. So how they have a role in reducing the infantile colic? First, so in studies they have shown that mechanism of action has not been completely determined. Okay, this is mechanism of action of probiotic in reducing the infantile colic. Okay, this could be mediated by activity on colonic intrinsic sensory neurons, so this can be by their activity in colonic intrinsic sensory neurons that will improve the gut motility. Secondly, they have already I have told they have this anti-inflammatory action. Third, they reduce the coliform growth. Okay, so these are the mechanism of action or a role by which it causes reduction in infantile colic. Okay, next, what are the recommended use for this mainly this NNEC, that is necrotizing enterocolitis. So according to the ESPGHAN guidelines, first, Lactobacillus rhamnosus GG at the dose of 1 into 10 to the power of 9 to 6 into 10 to the power of 9 colony forming units can be used. Second, a combination of Bacillus infantis, second Bacillus lactis, and Streptococcus thermophilus. This can be used at the dose of 3